We're going to begin with the health care debate. We're joined by Congresswoman Wasserman Schultz. She's part of the Democratic leadership up in the House. She's a Democrat from Florida. Congresswoman, thank you very much for being here.
Thanks for having me.
Let's get your reaction to Chairman Baucus over in the Senate on the Finance Committee. This was the fifth committee, 3 in the House, 2 in the Senate, finally coming out. All eyes were on this because this is the one that it seemed like the president was sort of attaching himself to in his speech last week, waiting for, might there be any bipartisan negotiation. Does the Baucus bill basically make the House versions that came out earlier this summer somewhat irrelevant?
Not in the least. You know, we're glad in the House that the Senate has finally joined the debate and produced legislation that we can take a look at and review and go through the normal legislative process. The beauty of our founding fathers and the way they structured the legislative process is that we're a bicameral legislative body. There are 2 houses which are co-equal, and our legislation, as we move it through and work with our caucus members to fine-tune it, will pass the House, and then the Senate will pass a bill at some point, and we'll have to go through the conference process. We're just pleased that they finally do have a product that we can take a look at.
Congresswoman, are you concerned? Chairman Rangel said yesterday that the president coming out last week has made it even more difficult to get things done in the House because of the limitations. Are you worried that you're going to have to scale back what the House does to try to keep in some of the promises that he put forward as part of his speech last week?
I think we're going to go through the normal legislative process, and there's going to be give and take. We will, I think all of us, all Democratic members, whether you're a senator or a House member, want to get as much significant health care reform as we can, and we support the 3 pillars that President Obama laid out last week in his speech. Making sure that people who have health insurance now can get stability and security, making sure that we cover every American that does not have health insurance, and dealing with the skyrocketing cost of health care. And those 3 pillars are important components of each of the bills, whether it's the Senate bill or the House bill.
Have you taken a look yet at some of the reports of what is in the Baucus proposal?
Yes.
And can you just give us sort of your reaction does that bill look like health care reform that you want to see passed?
Well, it looks like health care reform that's far better than the current system we have today. But
do you have any problems with it? Is there any concern about it?
I'm certainly concerned that there's no public option that's part of this legislation. That the requirement, while they required health insurance for individuals, they don't require it for employers to provide coverage. The subsidies, I think, are not going to be enough to ensure that people who are required to pay for insurance have the ability to afford it. So they have a long way to go. But certainly, because they eliminate the pre-existing conditions and the ability of insurance companies to drop you or not cover you for those, getting rid of annual and lifetime caps, those are significant. We've got significant reform in the Senate, but they've got a long way to go, as do we.
Is deficit neutrality an absolute must from your standpoint, from the standpoint of House leaders, that this does not add, as President Obama said, a dime to the deficit?
I think that's a critical part of the mandate for health care reform, yes.
And you think that's possible even with the parameters that you're supporting on the House versions of the bill?
I do think it's possible. I think it's September, and we've got a number of months before the end of the year. The president has asked us to put a bill on his desk by the end of the year. I think that we're going to do that. I think we're going to work extremely hard, day in, day out, hammering out the details, getting feedback from all corners of the country and members of every stripe and persuasion, and we're going to come up with significant health care reform that we can send to the president that make sure that we provide stability and security to all those people who have health insurance now, covers everyone, and addresses the skyrocketing cost.
Congresswoman, you mentioned one of the concerns with the Baucus bill, the finance bill that you saw so far, is this idea of the employer mandate perhaps not being strong enough in there or really present in there in some fashion. Do you believe that what you have seen about the Baucus bill thus far, would it unravel sort of the employer-provided health insurance system that so many in the country have come to receive their health care through that system?
Well, that's definitely a concern. I mean, added to that concern is the fact that they tax the sort of wealthiest benefit packages, and you've got some health insurance, quite a bit of health insurance policies in America that during the next couple of years will top the $16,000 and $21,000 mark that exists in their bill that triggers taxation. Those will be passed on to the policyholders and cause their insurance to go up. I think the House approach of financing healthcare reform is far more appropriate and balanced, and that's the approach that many of us favor. But again, we'll go through the conference process.
Right.
I think we should sort of downplay the gap that exists between the House and Senate versions right now. The conference process is time tested, and we'll go through it, and I'm confident we'll send a bill to the president.
Congresswoman Debbie Wasserman Schultz, Democrat of Florida, thank you very much for being here today.
Thank you.
We greatly appreciate it.